hand over the microphone and the stage to Dr. Renate Holzeisen. She will explain to what extent the EU has already widely anticipated WHO's project of Power Grip. Please, Renate Holzeisen.
Thank you, Philippe. And for this purpose, I have first of all to remind you of the following. The European prosecutor is investigating the COVID-19 vaccine deals of the European Commission's President, Ursula von der Leyen. Ursula von der Leyen is in a huge conflict of interest regarding at least all the decisions of the European Commission in the field of the biotechnology and the substances based on mRNA because of her husband's position and professional activity in that field. In the European Union, in the case of a public health emergency declared either by the WHO or the EU, it is possible to put on the market or in a conditional way also vaccines, so-called vaccines. Starting with 21st December 2020, the European Commission, on the basis of the alleged fake of a public health emergency of international concern declared in January 2020 by the WHO, and on the basis of the untruth that there was an unmet medical need, authorized as so-called COVID-19 vaccines, mRNA substances based on genetic engineering, under the condition that their efficacy and safety had to be confirmed by clinical trials. These clinical trials have never been conducted. And that these substances had no efficacy for the prevention of infection emerged from the beginning on also from the assessment reports of the EMA. Although the efficacy and safety of these experimental substances have never been tested and proven, in the meantime, the European Commission gave them even a 5-year valid unconditional authorization. So, and on this background, we face not only a brutal violation of European pharmaceutical legislation by the EMA and the European Union Commission, which puts in life and which puts on a high risk life and health of 550 million European Union citizens. But the European Union is now going even to change the European Union pharmaceutical legislation, reducing the regulatory burden and providing a more flexible regulatory framework. This obviously in order to be able to put on the market experimental substances also for mass vaccination programs without any risk to be held accountable for violation of so far principles of the European pharmaceutical legislation. So, we see an EMA and the European Union Commission, which in the last nearly 4 years committed already a criminal violation of the European Union pharmaceutical legislation by bypassing the legislation for the so-called advanced therapy medicinal products, defining clearly experimental gene-based substances simply as vaccines and putting them on the market for mass vaccination programs. So we have to remind that in June 2021, the European Parliament and the Council installed the European Union Digital COVID Certificate, which gave the so-called vaccinated, although there was no evidence that they couldn't transmit the virus, in contrast to the unvaccinated and the untested and the unrecovered, the possibility of free movement. The European Union digital COVID certificate was and is absolutely lacking in scientific evidence and a clear instrument of discrimination and a clear instrument for pushing the citizen to the so-called vaccination with experimental genetic engineering-based substances. The Council and the Commission are pushing for a worldwide, robust global health strategy. One of the core priorities of these two organs is enhancing the equity to the access to vaccines for a One Health approach, which tackles literally the complex interconnection of climate, environment, and animals with humanity, for a more effective disease surveillance worldwide, and for stronger international rules and cooperation mechanism on health. Well, this sounds very military. The Council declared a new global health order is emerging and that global governance will require a new focus to maintain a strong and responsive multilateral system with a WHO at its core. Consensus should be built through deepened cooperation through G7 and G20. And therefore, it wasn't a surprise that Mrs. Ursula von der Leyen pushed on last Sunday on the G20 in New Delhi the digital identity pass, asking especially the EU member states to reach the goal of 80% coverage within 2030. So the Council and the Commission also declared that there will be the need of a close cooperation with the private sector and the so-called philanthropic organizations. We see that the Council already concluded on vaccination as one of the most effective tools for preventing disease and improving public health. And the plan is to, the Council and the Commission invited the Member States to develop training opportunities, communication and social media training of the Member States to allow health professionals and health communication experts to become more versed in effective techniques and tools for countering so-called vaccine mis- and disinformation. This is the starting point. From that, the European Union and the European Union member states are negotiating the modification on the IHR and the new pandemic treaty. The Commission negotiates on behalf of the Union on matters falling within the Union competence, where the coordinated position of the member states is expressed by the presidency of the Council. From published documents of the Council results that there is the will of the European Union member states to address so-called misinformation and disinformation. And with a decision of March 2022, the Commission was authorized, as already said, to negotiate on behalf of the Union. And to the Commission, the Council gave instructions. And in these instructions, the Council declares that the Commission had to negotiate this new pandemic treaty and the modifications on the lessons learned during the COVID-19 pandemic. Regarding this, we have to point out that according to the data of Euromomo, the higher the COVID vaccination rates are, the higher is the excess mortality rate in the EU member states. The Council declared further in the instructions given to the Commission that as the exact scope of the envisaged international agreement is not yet known, it will revise the directives. So, regarding this point, we have urgently to ask formally what is the exact scope of the International Pandemic Treaty and the modification of the IHR, because in the directives, in the instructions given by the Council to the Commission, that is not clear. They are declaring expressly that they don't know the exact scope. This is very interesting. And the Council declared also in these directives that that the pandemic agreement and international health regulation will be legally binding for the parties, and so also for the European member states. So the Council's conclusions of the meeting of 9 December 2022 point out the need, the declared need of the combating of vaccine hesitancy. And therefore, the Council welcomes the Commission's intention to closely cooperate with the WHO in the development of the global digital health certification network, and taking in account the developments regarding the update of the IHR. So we are learning from the documents of the Council and the Commission that they are seeing the developments and the modification of the international health regulation as something given. The Commission has also now the possibility to conclude prepaid contracts with vaccine producers, and in exchange for the right to the result, which, as we saw with the COVID-19 vaccines, in case of inefficacy, is formally adjusted by the EMA. So we have regulations by the European Parliament and the Council of November 2022, which is always calling the European member states to further enhance their cooperation with the WHO, and in particular under the international health regulation. And therefore, we see that they are working directly for an acceptance of what is planned for next May 2024. I'm concluding, reminding also the fact that the Council recommendation of June 2023 claimed all the European Union member states to continue with the issue of the European Union digital COVID certificate, which lack completely of scientific evidence, in order to pass directly to the system of the WHO of a digital vaccine passport. This is the development. This is what is currently happening on the European Union level, and I recommend you to have a deeper look on the members of the group of chief scientific advisors to the Commission, as there are several members who have strong relationship with the World Economic Forum. Thank you.
Thank you very much, Dr. Renate Holzeisen.